I'd like to welcome you to Doctor in the Making, where we will be discussing all topics related to medicine with the top influencers and doctors in the state of Florida.
Hi, I'm Dr. Pero. How are you today? We're going to talk about vein treatment today here at Palm Beach Veins and Sandals Med Spa. We treat veins for a couple different reasons. We treat it for medical reasons and for cosmetic reasons. Usually most of them are caused by a medical condition underlying which is causing this, called venous insufficiency or venous reflux. There's different systems of veins in the leg. There's a deep system, mostly the deep femoral vein and popliteal vein. There's a more superficial system, and that's the greater saphenous vein, the small saphenous vein, and they can have different branches coming off of those as well. And if there's any kind of problem with the veins or a disease where the vein walls are too big, or for some reason the valves inside don't close properly here, where the blood is supposed to come up only and go up to the heart without coming back down, if the blood somehow gets through that valve and starts coming back down, either through veins that connect the deep system to the superficial system or just in the superficial system itself, they can feed veins that are closer to the surface, like varicose veins that might bulge out of the skin like this, or the smaller little fine spider veins that a lot of people see and that we have. Now, if you were going to try to treat just the spider veins cosmetically or the varicose veins cosmetically by itself without treating the underlying cause, it's not going to be very successful and you're not going to get a good outcome. What you really need to do is treat the underlying cause in order to do this, and that's a medical condition. Luckily, we've come a long way over the past few decades, where before we used to do an open procedure in the hospital called vein stripping. A lot of vascular surgeons used to do that. Now we can go in with a very small incision. It's minimally invasive, not much pain at all, and it can be done under local tumescent anesthesia in the office or outpatient center. Basically, what we want to fix are these veins that don't work properly. And what we do is we basically close them down. There's a couple different ways of doing it. There are lasers, there are radiofrequency devices, and even like a sterile glue that can be used, and other solutions that can be foamed and then injected into the veins to close them down. Basically, we're closing down the veins that don't work properly, rerouting the blood to other veins that do work properly, and then we get rid of that reflux, that increased pressure that we shouldn't have there. Because it can cause a lot of different symptoms. People can have pain in their legs, they can have aching feelings, tiredness, fatigue, sometimes numbness or just feeling tired. It can even cause restless leg syndromes. Also, it can cause just the cosmetic problems, spider veins, bulging varicose veins. Sometimes those can be very painful as well. And it can also cause restless leg syndrome. We also do just the superficial sclerotherapy injections on the surface for the spider veins. We also have laser treatment for spider veins as well that work well. Some people prefer one or the other, and then sometimes it just depends on the vein. Sometimes depending on the size or the diameter or the color of the vein, sometimes it's just better to use one or the other, the laser or the sclerotherapy injections. If you have any questions or if you have any issues with leg veins, give us a call.
Thanks for watching. If you like this video and you want to see more, click the like button below and follow me on Instagram at DoctorInTheMaking_. Also, if there's a topic you'd like to see us talk about, make sure you let me know in the comment section below. And always remember, be grateful.